Um, so today we're reporting out an additional 2,186 cases and an additional 38 deaths. Now, when we look at the trends, we are starting to see some declines in a number of indicators. We've seen some improvement in the number of folks who are hospitalized with COVID. We've seen some improvement in the number of folks who've required to be admitted to the ICU or even to be on a ventilator. And we've seen some declines in emergency department visits for COVID-related illnesses as well. And all of those things are great. But when we think about where we are compared even to the very large surge that we had over the summer, which seems small in comparison with what we're dealing with now, we are still seeing a lot of cases. 2,000 cases in a single day reported out from the health department is still indicative of widespread transmission throughout the state. And we are still seeing a lot of deaths. Obviously, in December, when you look at the numbers for the deaths that actually occurred during the month of December, not reported out, but actually occurred during the month of December, we reached over 1,000 deaths in December. To date, in January, we have reached almost the same number, 935 deaths that have occurred in January to date. And we still have a couple of days left in January. When you compare that to previous months, even during the summer surge months, in July we had about 700 cases, 700 deaths, and in August we had about 800 deaths. So you can still see that we are still in a time of great concern, even though we are seeing some improvement. We still need to stay fully vigilant on those things that we know have prevented transmission. Even though we're seeing some declines, now's not the time to let up on wearing a mask, social distancing, trying to limit your exposure to large social gatherings, do those essential things that you need to do day in and day out, but do them in a smart way with the proper way to protect against transmission. That applies even after you've been vaccinated. We want individuals, even after you've had 2 doses of vaccine, to continue to wear a mask, continue to social distance. Remember, we've done a lot of vaccinations in the last couple of weeks. But when you look at that, it's about 200,000. And when you compare that to the population of Mississippi and the population at risk in Mississippi, we still have a long way to go to achieve population immunity or herd immunity. So we want to continue to do everything that we can to prevent transmission, and that includes wearing a mask. And Liz, I'm going to turn that back over to you and Dr. Dobbs and Mr. Craig.
Okay, thank you, Dr. Byers. Mr. Jim Craig, can you talk to us? Actually, Thomas, I'm going to take you next. We're a little out of order today. Sorry about that. All right, Dr. Dobbs, why don't you talk about vaccine allocations?
Yeah, thank you, Liz, and thank you all for being here. Just to sort of kick it off, we're by and large very pleased with the vaccine rollout as it stands right now. More than 200,000 Mississippians have received a first dose of vaccine. We've given well over 225,000 total vaccines if you include second doses. We've got a pretty good rhythm going on right now, and we've got great partners. I'll tell you that the drive-through clinics, and I'll let Mr. Craig go into more detail in a moment, but the drive-through clinics are working well, and he's devoted a lot of time making sure they run smoothly. That does consume about 30,000 doses per week to the locations that receive the vaccine for the drive-throughs. Beyond that, we depend upon our local clinical hospital partners to make sure that they get the vaccine to their communities. And every clinic, every hospital approaches it a little bit differently, but we're working very closely to make sure not only that they can get it out efficiently and effectively, but also in an accountability sort of approach such that we can keep track of how much they're using and how quickly they're using it, so that we can make sure that it's efficiently distributed geographically throughout the state, but also to address underlying health disparities, whether that's because of geography, whether that's because of income or whether it's because of race or ethnicity. When we look at the number of vaccines that we get, usually we've been running around 37,000 doses a week. And the overage that was not used by the drive-through sites was shared with our partners. We are very excited and fortunate to share with you that we will have additional vaccine available for the next week. And there are several reasons for this. First and foremost, we were able to reclaim about 9,000 doses of Pfizer vaccine from the long-term care program. In collaboration with the governor's office, we've been working with CVS and Walgreens to determine the excess of Pfizer vaccine that they had in their inventories that we were able to pull down. And so that'll be available for use next week. In addition, we were given additional vaccine from the federal government. As anticipated, they have told us we can expect about 16% increases over the next few weeks. And so those combined, we should have an additional 15,000 doses or so just from those two sources. And we're working to make sure that we get that quickly into the arms of eligible Mississippians as we go forward. Just one thing I will say also, we've done a really good job about getting it to folks who are at risk. If you consider residents in Mississippi who are 75 and older, over a third of our residents in that age group have received vaccine. So those are successes we want to build on. We did add a significant number of first dose appointments for the second week of February. So if you're eligible and want to get vaccinated through one of the county drive-through locations, please go to covidvaccine.umc.edu. Additionally, we do have second dose appointments available. They should be available for everyone who's had a first dose already. And we have the system worked out now that after you get your first dose, you should be able to schedule your second dose immediately thereafter. So that's all I have to share for this moment, and we'll answer questions shortly, and I'll kick it back over to Liz Charlotte.
Thank you so much, Dr. Dobbs. Did you want to explain, sir, before we go to Mr. Craig, about the long-term care facility allotment, that's different from the 37,000? Don't we get that order on Tuesdays?
Yeah, that's a really good question. So for the long-term care program, CVS and Walgreens were in a federal partnership to immunize people in nursing homes and other sort of licensed long-term care facilities. And we had to actually commit our vaccine up front. And that's one of the reasons why we were off to a slower start than we wanted to, because we had to pre-assign and put all that vaccine, tens of thousands of doses initially, basically aside for that program so they could activate. So they didn't really work on the sort of like the real-time inventory sort of process we're doing. They actually had a lot of it to start with. As they've gone through, we have identified, and they've identified with us, that they're not going to need all the vaccine that was set aside for that program. And so we're reclaiming it so that we can use it to vaccinate other Mississippians who are in need.
Thank you so much.
Yeah.
Thanks, Dr. Dobbs. Mr. Jim Craig, County Health Department drive-through sites. What would you like to say?
Yeah, so if you don't mind, I'd like to share my screen for just a minute. So can you see the screen? Good. So thank y'all for taking an opportunity for let me provide a short briefing on our state drive-through locations that are being provided throughout the state of Mississippi in these geographic regions that you see on the map. You're familiar, last week we talked about adding our 19th site, which was Hinds County, the Smith-Will Stadium location. Since then, we've also worked on developing two sites that counties have been working to develop over in Warren County and in Lawrence County that will be providing some state support to those particular sites beginning next week. So DeSoto County and Panola up in the north, the DeSoto County location moved this week from the County Health Department to the Landers Center. It's a large civic center in DeSoto County in Hernando, Mississippi. In Washington County on Tuesday, we moved to the Coliseum from the health department there. And also in Leflore County, we moved to Floorwood. It was a former state park that has been provided to the county, and the county has provided that as a location to provide vaccination for the state site in that particular area. The other change during the week this week was down in Pike County. We moved to the Edgewood Mall on Monday, and operations are behind what was the old Goodies store in the mall there. As I said, we have 2 new facilities coming on board next week, Pemberton Mall in Warren County, and also in Lawrence County at the Senior Center. To date, since January 4th, when we started these drive-through operations, we have administered 80,484 doses within those sites. As Dr. Dobbs alluded to just a moment ago, we'll be providing over 30,000 doses next week, which is our normal cadence to provide 30,000 doses per week through the first doses through these drive-through sites. Next week, we'll also begin our second shot appointments, and we will be administering better than 49,000 doses of first and second doses in the drive-through locations throughout Mississippi next week. A lot of people have been asking about extended hours. Right now, our hours for drive-through operations are between 9 a.m. with last appointments at 3:40 in the afternoon, so that the work is completed about 4 p.m. so that the teams, many of which have to travel from all parts of the state to assemble at these locations, can return safely back to their homes in the evenings. But we will continue to look at extended hours and see as we get longer days, if that may be something that we can do as well. The real limitation of that right now is the amount of vaccine. Obviously, if there was more vaccine, there would be potentially more hours that could be operated as well. As you note, we strategically placed these drive-through clinics throughout the regional concept so that we would have vaccine available throughout the state of Mississippi through the drive-through operations. We are contacted by a number of counties, boards of supervisors and others, about additional drive-through locations in their counties. We worked this week to develop some guidance to provide to those counties to let them know all the things that would be necessary if they want to operate a county location for vaccine. As Dr. Dobbs said earlier, there are a lot of different ways to get vaccine, and drive-through operations is just one. There are a lot of other ways with our vaccination partners and hospitals and other healthcare entities that are working to also provide vaccine more locally. The question we get quite often is, well, if I want to have a county site, is it just people from my county? And these are state vaccination sites. So when the appointments go on the state system, people from around the state can travel to any of these locations to receive vaccination. So it's not limited to just that county.